So we can start. So 50th page we will be starting. Bhalladaga Kalpa Prayoga. Okay, so in where we will be getting the references regarding the Bhalladaga Kalpa Prayoga. So in Charaga it is mentioned under Rasayana. In Charaga Chigilsa Sthana, the first chapter is Rasayana. So in that Rasayana Adhyaya, you can see the Bhalladaga Prayoga references you will be getting. Okay, so in the Rasayana chapter you will be getting Bhalladaga Prayoga, and Charaka is telling in the starting time you have to take 10 Bhalladaga. Like how Vardhamana Pippali Rasayana will be taking, in the same way Bhalladaga has to be taken. So the starting should be 10 Bhalladaga should be taken. Okay, then according to Sushruta, Bhalladaga Prayoga is mentioned under Arsha Roga Adhikara. In Arshas, he has mentioned Bhalladaga Prayoga, and he is telling how to take Bhalladaga, one Bhalladaga at the beginning. So beginning will be starting with one Bhalladaga. Then Vagbhata, he is telling 8 Bhalladaga should be taken. So these are the number of Bhalladaga should be taken during the Bhalladaga Prayoga. According to Charaga, 10 Bhalladaga. According to Sushruta, 1. According to Vagbhata, 8. And Charaga mentioned under Rasayana Chigilsa, Sushruta has mentioned under Arsha Rogas. Okay, so these are the main references regarding the Bhalladaga. Next one is Shilajadu Prayoga, so that is mentioned by Charaga. Okay, so Pravara Matra, how much dosage you have to take it? 4 Tola or 1 Pala Shilajadu has to be taken as a Pravara Matra, and how much days you have to take it? For 7 weeks. Okay, 7 weeks we have to take Shilajadu 1 Pala dosage. This is Pravara Matra. And Shilajadu 2 Tola or half Pala for 3 weeks if you are taking, that is Madhyama Matra. Okay, and Shilajadu 1 Tola or 1 Karsha for 1 week, that is Avara Matra. So these are the dosages of the Shilajadu. Then next one is types of Shilajadu, very very important. So 4 types are the Swarna, Rajada, Tamra, Loha Shilajadu. Okay, Swarna, Rajada, Tamra, Loha. So Swarna Shilajadu, it is having Madhura Tikta Rasa, and it is looking like Jaba Pushpa Sadrisha. Okay, hibiscus flower is there, no? So in that way it will be looking Jaba Pushpa Sadrisha, and it is Vada Pitta Shamaga. So Swarna Shilajadu is Vada Pitta Shamaga, it is Madhura Tikta Rasa, and it is looking like Jaba Pushpa Sadrisha. Next one is Rajada Shilajadu, it is Katurasa, and it is looking like Shveda Varni, white discoloration will be there, and it is Kapha Pitta Shamaga. Tamra Shilajadu is Tikta Rasa, and it is looking like Mayura Kanda Sadrisha. Okay, neck of the peacock. Okay, peacock neck is there, no? So that will be a little bit bluish tinge will be there. So that type of color you will be getting. Okay, so that is Kapha Shamaga. Okay, Mayura Kanda Sadrisha is Tamra Shilajadu, Tikta Rasa, it is Kapha Shamaga. Then Loha Shilajadu, the Rasa is Tikta Lavana Rasa, it will be looking like Guggulu. Okay, Guggula Bhasa. Okay, looking like a Guggulu, if you are getting Shilajadu, that is Loha Shilajadu, Tikta Lavana Rasa, it is Tridosha Shamaga. Okay, so that is a benefit of the Loha Shilajadu. So these are the 4 types of Shilajadu: Swarna, Rajada, Tamra, Loha. Tamra Shilajadu is Ushna Virya. Okay, Tamra Shilajadu is Ushna Virya, and the rest of all the Shilajadu are Shida Virya. Okay, Tamra Shilajadu is Ushna Virya, and Swarna, Rajada, Loha is Shida Virya. Next one is Rajada Shilajadu Madhura Vipaki hai, Shesha Sabhi Katu Vipaki hai. So Rajada Shilajadu, it is Madhura Vipaka. Okay, Katu Rasa Madhura Vipaka. Okay, Rajada Shilajadu is having Katu Rasa, but Vipaka is Madhura Vipaka. Okay, this is the only Shilajadu which is having Madhura Vipaka. Rest of the other Shilajadus is having Katu Vipaka. Okay, Rajada Shilajadu, it is having Kadu Rasa, but Vipaka is Madhura Vipaka, and rest of the Swarna, Tamra, Loha, it is having Katu Vipaka. Okay, so these are the additional points related with the Shilajadu. Tamra Shilajadu is having Ushna Virya, rest of the things are having Shida Virya. Rajada Shilajadu is having Madhura Vipaka, and rest of the Shilajadu is having Katu Vipaka. Next is we can see some of the shlokas related with some condition, very very important. Okay, Muhur Daha, Muhur Shida. Okay, like intermittently you will be getting burning sensation and the cold sensation, Daha Shida. So now you will be getting severe daha, burning sensation will be there, and then afterwards you will be getting Shidatva. Okay, like that alternative temperature you will be getting. Muhurdaha, Muhurshida. So this is one Lakshana of the Slaishma Paitiga Jwara. Okay, Kapha Pitta Jwara. In that condition you can see this Lakshana. The same Lakshana you can see in another one more condition. Kshane Dahe Kshane Shidam Lakshana. Okay, same thing only, but the words are different. So Kshane Daham Kshane Shidam, that is a symptom of Sannipadika Jwara. So this type of quotation if they are telling, so you have to see which context. Okay, so very important. Muhurdaha Muhurshida, it is mentioned under Kapha Pitta Jwara. Kshane Daha Kshane Shidam, it is mentioned under Sannipadika Jwara, because they used to mention the lines and they will ask you to identify in which context these lines are coming. So that these lines are very important. Okay, so Muhurdaha Muhurshida, Kshane Daha Kshane Shidam, both are having same meaning, but it is mentioned under two different conditions. Muhurdaha Muhurshida is mentioned under Kapha Pitta Jwara. Kshane Daha Kshane Shidam is mentioned under Sannipadika Jwara. Next, in the same way, some other quotations also you can see. Vada Purna Dhrudi Sparshaha Shodaha. It is mentioned under Sandhi Gada Vada. Okay, in Sandhi Pradesha, Vada Pragopa is happening, then you will be getting a swelling. Okay, Shoda you will be getting. Okay, in Sandhi Pradesha, Vada Pragopa is happening, then first of all you will be getting a swelling. Okay, Shoda. In that Shoda, if you are palpating, you can feel that it is filled with the air. Okay, Vada Purna Dhrudi Sparshaha Shodaha. So you are getting a swelling, and while palpating that swelling, you can feel that it is filled with the air. Okay, so that is the Lakshana of Sandhigada Vada. Okay, Vada Purna Dhrudi Sparshaha Shodaha. It is mentioned under Sandhigada Vada. Okay, in the same way, another one more Lakshana you can see. Atmada Dhrudi Shabdavad Bhavadi Lakshana. This is also indicating same thing. There will be one elevation will be there if you are just doing the percussion. Okay, like a percussion if you are doing, so we can hear there is a air filled, that a resonant sound you can hear it. Okay, Shabdavat Bhavadi. That is comes under Vada Udara Lakshana. Okay, Udara Roga is that, so different type of Udara Rogas are there. So in that Vadaja Udara. So Vadaja Udara means there is there will be in Udara there will be air filled abdomen will be getting. Okay, so that is a main Lakshana of Vadaja Udara. So Atmada. So Atmada means there is a air is getting filled inside the Udara. If you do the percussion, you can see that air resonant sound, you can feel it. Okay, Atmada Dhrudi Shabdavat Bhavadi. So this is the Lakshana of Vadaja Udara. Okay, so the Vada Purna Dhrudi Sparsha Shodaha, that is also almost similar, like you are getting a swelling that is filled with air. So that is a Lakshana of Sandhigada Vada. In Udara you are getting a air filled cavity. So if you are just doing the percussion, you can feel that resonant sound, you can hear it. So that is the Lakshana of Vadaja Udara. Yada Dhrudi Kshubhyade Kambade Cha Lakshanaha, that is mentioned in Jalodara Chigilsa. Okay, in Jalodara what is happening means, Jalodara means that is a fluid is getting filled in the abdomen. Okay, that we can correlate with the ascites condition. So there is a fluid is there. So Yadha Dhrudi Shubhyade Kambade. So if you just palpate that, okay, if you just palpate that abdomen which is filled with the fluid, if you just palpate it, you can see there is a there will be fluctuating of the water fluid, you can hear it. Okay, if you just if it is a fluid filled abdomen, then if you just do the palpation or percussion, we can feel that is a water filled cavity, like that you can feel it. So that is the Lakshana of Jalodara. Air filled cavity if you are getting Vadaja Udara, like a fluid is getting that if you just palpate it, you can feel that is a fluid has become filled in the cavity. Or if you do the percussion, you can see that fluid sound also we can hear it. So these are all Lakshanas of Jalodara. Okay, Yadra Dhrudi Kshubhyade Kambade. Okay, so that is a Lakshana of Jalodara. Okay, that is mentioned by Susruta. The same thing is Charaka is also telling Udaga Purna Dhrudik Shobhe Samsparshaha. If you just touch the abdomen, so Udaga Purna, you can feel that it is filled with the water. Dhrudik Shobha Samsparshaha. Like if you just do the percussion, you can see there will be water moving water moving, that sound we can feel it. So these are the Lakshanas of the Jalodara. This is mentioned by Charaka. Okay, the same thing is Sushruta is also mentioned, but it in a different way he has mentioned. Okay, Yada Drudi Kshubhyade Kambade. There will be movement, that water movement we can feel it. Okay. Udagapurna Dhrudikshoba Samsparshaha. Water filled abdomen you will be getting. So while palpating you can feel that water moving things, we can feel it. So that is told by both are telling same thing only, but the lines are little bit different are there. Okay, so that you have to focus it. So where this line has mentioned, it is very very important. Okay, because almost all the exams they are one of the other lines of slokas they are mentioning in the exam. So this sloka lines are very very important. Next one is Jalavasti Samasparshaha. It is a lection of Pachyamana Vranashofa. Pachyamana Vranashofa means you will be getting a swelling that will become Paka. Okay, like during the inflammatory process. One swelling will be getting. Okay, so swelling like shofa, 3 types are there, no, based on the this inflammatory process. Ama, then Pachyamana, Pakva, Vrana, shofa, like the 3 stages are there. Okay, so Pachyamana means during the inflammatory process is going on. Okay, inflammatory process is going on, so that is Pachyamana. So that time if you just press the swelling, you can feel that is Jala Vasti Samasparsha, which means that is filled with the water, we can feel it. Okay, there is a swelling is happened. If that inflammation is going on, inflammatory process is started, then if you just touch that swelling, okay, if you touch the shofa, you can see that it will be filled with the fluid, you can feel it. Jala Vasti Samasparsha. Okay, Vasti which is filled with the jala, like that feeling you will be getting when the shofa is in Pachyamana Avastha. Okay, so this is told by Charaka. Okay, the same thing is told by Sushruta also. Atmada Basti Riva. So here Sushruta is telling Atmada Basti. Okay, which means fluid filled Basti will be feeling. Okay, Charaka is telling Jala Basti. So the fluid, Atmada Basti means air filled cavity. Okay, Atmada means air. So the Basti which is filled with air, that type of Lakshana is told by Sushruta. Jala Basti, the fluid filled Basti will be feeling according to Charaga. Okay, Pachyamana, the second stage of the Vranashofa, according to Charaga, while touching the swelling, it will be looking like it is filled with the water. Jala Basti. Okay. Sushruta is telling during the second stage of Vranashofa, that inflammatory process is going on. So that time, that swelling, if you just touch it, that will be feeling like Atmada Basti, that is filled with the air, like that you will be feeling. Okay, so Jalavasti Samasparsha, that is mentioned under Pachyamana Vranashofa, that is told by Charaga. Atmada Basti Riva, so that is comes under the Pachyamana Vranashofa mentioned by Sushruta. Next one is Ambu Purna Dhridi Riva Kshubhyade Mutra Krichnam Lakshana. So this is mentioned under Mutraja Vriddhi. Okay, Mutraja Vriddhi means excessive urination. Okay, like there is too much of urine is getting collected in the bladder. Okay, maybe because of the urine has formed, but because of some of the problem you are doing Mutra Vega Dharana. Okay, due to some reasons you are doing Mutra Vega Dharana, so the Mutra is getting collected inside the bladder. So that time, what are the Lakshanas you will be getting? Ambu Purna Dhridi Riva. So if you just palpate the Basti, so you can see that is fluid filled Basti we will be getting. Kshubhyade, there will be fluctuating, that water movement we can feel it. Mutra Krichnam, because of the continuous Mutra Vega Dharana, there will be difficulty in urination will be there. So these are the Lakshanas of the Mutraja Vriddhi. Okay, so Mutraja Vriddhi, if there is excessive urine is getting collected in the bladder, then what are the symptoms you will be getting? Ambu Purna Dhridi Riva. So the Basti will be feeling that it is filled with the water, and there will be a movement of the water, we can feel it while palpating, and there will be difficulty in urination will be there. So these are the symptoms of the Mutraja Vriddhi. Okay, so these quotations are always we will get confused. So Vada Purna Drudi Sparsha Shodaha Sandhigata Vada. The same like that one another symptom Atmada Drudi Shabdavad Bhavadi Vadaja Udara. Yada Drudi Kshubhyade Kambade Jalodara. Udaga Purna Drudi Kshoba Samsparshaha Jalodara. Jalavasti Samasparshaha Pachyamana Vranashofa. Atmada Bastiriva Pachyamana Vranashofa. Then Ambu Purna Dridiriva Kshubhyade Mutra Krishna Mutraja Vritti. So these quotations are very, very important. Next one is Jirna Jiryade Atmanam Bhukte Swastyam Upedi. So this Lakshana comes under the Vadaja Grahani. Okay, that is mentioned by Charaka. So in Vadaja Grahani, Jirne Jiryadi Atmanam. Okay, like there will be temporarily you will be feeling some relief from the pain. Okay, in Vadaja Grahani there will be severe abdominal pain will be there, and there will be a little bit of constipation, all the things will be there. So that is the main Lakshana. Okay, severe constipation will be there, and abdominal pain, there will be delay in digestion or irregular digestion, like that of Lakshanas will be there. In that one symptom they have mentioned is Jirne Jiryadi, like after the intake of food. Okay, after the intake of food, immediately you will be feeling some temporarily relief from all the symptoms. Okay, swasthyam you will be getting. Okay, there will be bloating of abdomen severely you can get in the Vadaja Grahani. So that if you take food, then what happen? So during the time of digestion you will be feeling temporarily relief from all the symptoms of the Vadaja Grahani. Okay, Jirne Jiryadi Atmanam Bhukte Swasthyam Upedi. So while taking the food, you will be having the reduction of the symptoms, you can feel it. So that is for temporarily only. So after some time again there will be aggravation of symptoms will be getting. Okay, so this is mentioned under Vadaja Grahani. Next one, Bhukte Anne Labhade Shandim Jirna Matre Pradamyati. So this is a Lakshana, this is mentioned under Tikshnagni. Okay, so in Tikshnagni what is happening? Bhukte Anne Labhade Shandim. So whatever food you are taking, so that time immediately it will get digested, and whatever the symptoms are, that will become reduces. Okay, then after that what happen? After the digestion of the food, again the appetite will become increases. Okay, Jirna Matre Pradamyadi, like if you are taking food, so that time the Tikshnagni related symptoms will become reduces. When after the digestion of the food, what has happened? Again the symptoms will get aggravated. Jirna Matre Pradamyadi, the aggravation of the symptoms will be happening. Aggravated after the digestion of the food, sudden aggravation of the symptoms will be getting. So that you can see in the Tikshnagni. The similar symptom you are seeing in the Vadaja Grahani also. Okay, Jirne Jiryadi Atmana. So while you are taking the food, so that time symptoms are reducing. After the after the digestion of the food, what happened? Again there will be Vadaja Grahani symptoms will be started to coming. The same thing you can see in Tikshnagni. Bhukte Anne Labhade Shandim. So while you are taking the food, so that time there will be a reduction of the symptoms will be there. Jirna Matre Pradamyati. When the digestion is completed, all the symptoms will get aggravated. Okay, so that is a selection of Tikshnagni. It is also known as Bhasmaga. Okay, next one is Jirne Jiryadi Ajirne Va Patya Apatya Prayogena. Okay, this is a selection of Annadrava Shula. Okay, Annadrava Shula means there will be pain will be there, abdominal pain will be there during the after the digestion of the food. Okay, Annadrava, after the digestion of the food, the pain will be there. During the digestion also pain will be there. Okay, always there will be constant abdominal pain you can see in the Annadrava Shula. Okay, Annadrava Shula means here you are getting abdominal pain. During the digestion of the food, after the digestion of the food, always there will be abdominal pain remain constantly will be there. Okay, and this abdominal pain, it will not relieved by Patya Apatya Prayoga. Okay, Jirne, Jiryadi, Ajirne. Okay, So during the digestion, after the digestion, all this time they always will be having severe abdominal pain, and it is not getting relieved by Patya Apatya Prayoga. If you follow Patya also, you are not the abdominal pain is not reducing. If you are following Apatya also, the same pain you are getting. Okay, so abdominal pain, it is not relieved by Patya Apatya Prayoga. So if you take Patya food also, the pain is not reducing. Okay, because in some abdominal pain condition, if you follow Patya Ahara, abdominal pain reduces. But in this Annadrava Shula, if you follow Patya also, if you follow Apatya also, same abdominal pain you will be getting. So that is a lection of Annadrava Shula. Okay, next shloka is Bhukte Jiryadi Yat Shulam Tadeva Parinamajam. So this is a lection of Parinama Shula. So Parinama means transformation. So after the digestion of the food, if you are getting severe abdominal pain, that is called as Parinama Shula. Bhukte Jiryadi, whatever food you have eaten, after the complete digestion, Yat Shulam, there will be abdominal pain will be generating, then that is called as Parinama Shula. If it is Annadrava Shula, always abdominal pain will be there, and it will not relieved by Patya Apatya Prayoga. Okay, so by taking the Patya or Apatya Prayoga also, abdominal pain is not relieving, then it is Parinama Shula. And after the digestion of the food, if you are getting the pain, then it is called, if you are like always abdominal pain is present, if you are taking Patya Apatya, but then also pain is not reducing, then it is Annadrava Shula. After the digestion of the food, if you are getting severe pain, then it is Parinama Shula. Parinama means transformation. So after the digestion of the food, if you are getting the pain, Parinama Shula. Okay, so Annadrava, Anna is getting digesting. So during the process of the digestion, after the digestion, always the pain will be present. Okay, after taking the Patya Ahara or Apatya Ahara also, pain is not moving, then it is called as Annadrava Shula. Okay, next one is Ahara Parinamande Bhuyascha Labade Balam. Okay, so that is a lection of Vyapeda Hika. Okay, so Vyapeda Hika also the same thing you are getting. Okay, so Ahara Parinamande, which means after the digestion of the food, the Hika Vega is increasing. Okay, that you can see in the Vyapeda Hika. Okay, Ahara Parinamande. So the by reading that line, we will be thinking it might be Parinama Shula, that type of things we will be feeling. So that's why Ahara Parinamande Bhuyascha Labade Balam. So after the digestion of the food, the Hika, okay, Vyapeda Hika is getting Bala. So because of that, severe Vega will be getting. Okay, so this lection comes under the Vyapeda Hika. So these are all confusing type of quotations. Okay, so these are all you have to study. Next one is Harida Shirna Loma Lakshana. This you can see in the Pandu Varna. So in the Pandu Varna people, they will be having discoloration in the hair follicles will be there. Okay, Harida, maybe green color type of Lakshana, green or greenish yellow, that type of colors you can see. And Shirna Loma, there will be falling of hair. These are all you can see in the Pandu Roga. Almost a similar Lakshana you can see in Dushta Pradishaya also. Hari Arjuna Lomavada. Okay, so the hair will be having Hari Arjuna, like a reddish discoloration or green discoloration. So this type of discoloration you can see in the hair on the head. Okay, Shirke Bala Hona Lakshana. Okay, if you just examine the hairs in the head area, you can see there will be discoloration of the hair. You can see that is the lection of Dushta Pradishyaya. In Pandu also the same lection is there. Haridaha Shirna Loma. So the greenish discoloration, and there will be falling of the hair follicles will be there. So that you can see in Pandu, and the same almost a similar lection you can see in Dushta Pradishyaya also. Next one is Na Veti Gandha Rasamsha Lakshana, you can see in Apinasa. There will be loss of smell, loss of taste will be there. Okay, if it is a Apinasa condition, loss of smell, loss of taste will be there in Apinasa. Okay, Na Veti Gandha, there will be loss of smell only, that you can see in Dushta Pradishyaya. Okay, loss of smell and loss of taste you can see in apenasa. Loss of smell that you can see in dushta pradishaya. This is also we used to get in the exams. In one of the quotation they will be telling and tell you to identify in which condition you are getting. So these all quotations are very very important. Okay. Next one is Khalitya, Palitya, Harikeshada. These are all hair disorders. Okay. So in Khalitya, Vada Pitta dosha is the predominant thing. And in Palitya, Vada Pitta, Alpamatra. Okay. If it is excessive Vada Pitta, has become aggravated, then you will be getting Khalitya. In a medium level, okay, Vada Pitta Pragoba is happening, then you will be getting Palitya. Only mild Vada Pitta Pragoba is, then it is called, then you will be, that you can see Harikeshada. Okay, in these three conditions, Vada Pitta is the dosha. If it is in excessive way, then you will be getting Khalitya. If it is in a mild, medium level, it is aggravated, then it is Palitya. Mild level aggravation, it will be leads to Harikeshada. Okay, Khalitya, loss of hair will be there, alopecia type of condition. Palitya, that grey hair, that whitish hair will be getting, that is Palitya. Harikeshada means that greenish type of color discoloration you will be getting, like greenish, no, that a brown discoloration type, no, so that type of hair if you are getting, that is Atyalpa Matra Vada Pitta Prayoga. Vada Pitta is getting vitiated. Okay, so these are the dosha vitiation happening in the Khalitya, Palitya, Harikeshada. Next one is Pranavayu ke adheen hai Jeevan. Okay, so the Jiva, like the life. Okay, the life is based on the Pranavayu. Okay, if you are if you have any breathing problem, we will be giving oxygen. No, in the same way. Okay, so the life is depends upon the Pranavayu. Okay, then Udana Vayu ke adheen hai Bala. So the Bala of the body is depends upon the Udana Vayu. Okay, Jeevana is depends upon the Pranavayu, Bala is depends upon the Udana Vayu. Then Pradhanatama Yendra is Hasta and Pradhana Yendra is Kangamukha. Okay, so this we have seen in the Yendra. Next one is Bala Amra is Vada Pitta Vardaka. Okay, like a immature Amra is there, no, like mango. Okay, the starting stage. So that is Bala Amra is Vada Pitta Vardaka. Baddha Kesara Amra, which means like it is not completely that yellow mango, or it is not completely raw. Okay, it is not completely ripened, it is not completely raw, like that in a medium level. Baddha Kesara Amra, that is Pitta Vardaka. Pakwa Amra means that ripened mango. Okay, that is Vada Shamaga. Okay, so based on the stages of the Amra, different dosha vitiations are there. Bala Amra is Vada Pitta Vardaka. Baddha Kesara Amra is Pitta Vardaka. Then Pakwa Amra is Vada Shamaga. Okay, next one is Kacha Bilva, the raw Bilva. Okay, so that is Kaphavada Shamaga. Pakwa Bilva, ripened Bilva, that is Vidaha Janaga, Pudi Maruda Karaga. Vidaha Janaka means it induces burning sensation. Pudi Maruda Karaga, it will induces like a foul smell and Vada Vriddhi. These are all happens while you are eating Pakwa Bilva. Okay, that the raw bilva if you are eating, that is Kaphavada Shamaka. So that Kacha bilva has to be taken for the medicinal purpose. Then Ardra Marija. Okay, so the Marija which is Ardra, wet type. So that is Madhura Rasa. Like a fresh one. Okay, fresh Marija is Madhura Rasa, Madhura Vibhaga, Kaphavardaka. Shushka Marija, dry Marija, that is Katurasa, Avrishya, Kaphavada Shamagam. Okay, it is Katurasa and it is Avrish. It is not good for the Vajikarana and it reduces Kaphavada dosha. Okay, Pippali we have seen in the same way. Marija also different properties are there. Then Kachi Muli, that is Sarvadosha Nashaka. Pakwa Muli is Trudosha Janaga. Okay, Mulaga, Kachi, that is Sarvadosha Nashaka, the raw one. Pakwa Mulaga is Trudosha Janaka. Then Avyakta Tattva, according to Charaga, Avyakta Tattva is Buddhi. According to Sushruta, it is Mahan. Then Chigil Sarda, according to Sushruta, Chigil Sarda is Siraveda. Okay, so according to Sushruta, if you do Sira Veda, half of the disorder will become cure. So that's why Sira Veda is considered as Ardha Chigilsa according to Sushruta. According to Charaka, Basti is called as Ardha Chigilsa. Okay, then Shalya Vishayarda. If you wanted to study the Shalya Tantra, you have to study Marma. Okay, so if you know the Marma, then half of the Shalya knowledge you will be getting. Shalya Tantra knowledge will be getting. So Shalya Vishayarda, that for that you have to study Marma. That is according to Sushruta. If you study Marma, most of the Shalya Tantra topics we will come to know. Then Vaidya Krita Vrana. Okay, physician induced Vrana. Okay, because of the improper way, if the physician is creating Vrana, then what are the lakshanas? Ayadashcha, Vishalascha, Suvivakto, Nirashraya. Okay, so these are the lakshanas of the Vrana. If it is Avaidya Nimitta, if it is not physician induced, due to some of the other reason, if you are getting Vrana, then opposite one you will be getting. Ayadashcha, Chadurastra, Trayasra, Mandalistada. So these are the lakshanas of the Avaidya Nimitta Vrana. Okay, Ayada means like an extended one. Chadurasra, maybe 4-dimensional. Trayasra or otherwise 3-dimension, that 3 margins will be there. Mandali or otherwise is circular shape. In that way, if you are getting Vrana, that is Avaidya Nimitta Vrana. Okay, if it is Vaidya Krita Vrana, Ayadashcha, Vishalascha, Suvibhakto, Nirashraya. So there will be physician induced Vrana, that will be very easily we can cure it. There will be correct border will be there, and there will be no Ashraya Sthanas will be there, and Vishala like extended some base will be there. So we can easily cure that Vaidya Krita Vrana. So these are the qualities of the Vaidya Krita Vrana and Vaidya Nimitta Vrana. Then Shirovasti Avadana is mentioned by Sushruta, Vidalaga is mentioned by Vakbhata, and Pindi is mentioned by Sharanghadara. A treatment part. Then in the Yoni Vyabhat, in the same type, whatever quotations we have seen before, no, in the 50th page, in the same way, some points are there related with the Yoni Vyabhat. Nashta Artava. Okay, Nashta Artava means like an absence of menstrual cycle. That you can see in the Vandya Yoni Vyabhat. Okay, this is also very, very important. Okay, Nashta Artava you can see in the Vandya Yoni Vyabhat. Okay, Anartava. That is, you can see in the Shandi Yoni Vyabhat, Anartha, which means there is primary amenorrhea, like that. Like Nashtartha means that previously you have got a menstrual cycle, now you are not getting because of some problem, you are not getting the amenorrhea case. That is Vandya Yoni Vyabhat. Anartha means primary amenorrhea. So, like you have not attained the sexual secondary sexual characteristics, like all those things. So that is comes under the Shandi Yoni Vyabhat. Then Dushprajada, like a difficult labor, that you can see in the Prasramsini Yoni Vyabhat. Dushprajadamaya. Dushprajadamaya means Sutika Roga. Okay, because after the delivery, postpartum time, women they used to get some disorder. So that is called as Dushprajadamaya, or otherwise known as Sutika Roga. That is mentioned by Kashyapa. Then Karnini Yoni Vyabhat. Okay, Karnini means there will be expulsion of the there will be some growth will be happening inside the yoni. So that is called Karnini. So that is how it is forming. That is Kapha Rekta Dushti. Because of that, this Karnini Yoni Vyabhat will be happening. The dosha Visheshan. So this very, very important. Nashtartava, Anartava. Always we used to get confused. Okay. Nashtartava, Vandya Yoni. Vandya means infertility in that way. So for getting infertility, there will be the amenorrhea we used to happen, a secondary amenorrhea. Then Anartha means primary amenorrhea. So that you can see in the Shandi. Like genetically they are having some chromosomal abnormality. So because of that, what happened? They are not attaining the secondary sexual characteristics. So because of that, they are not attaining the menstrual cycle. Okay. So like that way you can remember Shandi Yoni Vyabhat. In that Anartava we can see. Then next one is Jadaharini. Okay. Jadaharini means there are some group of disorders which is affecting only the woman's reproductive system. Okay, Jadaharini means the disorder which is affecting only the woman. Basically, it is affecting the reproductive system. Okay, that conditions are called as Jadaharini. Total number of Jadaharini is 35 in number. 35 disorders are there which is affecting the women's reproductive system. So among the 35, 11 are Sadhya, 16 are Yapya and 8 are Asadhya. Okay, and in among the 35 Jadaharini, some condition which is affecting the mothers. Okay, mothers they used to get some disorders. Okay, that is total 10 in number. Okay, Jivida Mada woman 10. So the mothers they used to get some disorder which is affecting the reproductive system. So that is 10 in number. Total 35 Jadaharinis are there. Okay, so that is Jadaharini. It is told by Kashyapa. Okay, he has mentioned about the Jadaharini, which means the disorder which is affecting only this woman, and that is basically they will be damaging the reproductive system of the woman. Okay, that type of conditions are called as Jadaharini. Then in Charaka Samhita, how many Rasayana yogas he has mentioned? That is totally 63. Okay, so total 63 Rasayanas he has mentioned. So Charaka Samhita first chapter is Rasayana. So the Rasayana is divided into 4 pada. The first pada is called as Abhayamlakiya, then Karaprajidiya, then Pranakamiya, then Ayurveda Samuthaniya. So these are the 4 pada of Rasayana Chikitsa. In that Abhaya Amlakiya pada, 6 Rasayana he has mentioned, Karaprajidiya 16, Pranakamiya 37, then Ayurveda Samuthaniya 4. These are the number of Rasayana he has mentioned in the each chapter of the Rasayana. Next, Charaka Samhita Chikitsa second chapter is Vajikarana. Vajikarana also it is divided into 4 pada. Samyoga Sharamuliya, Masha Paranabhradiya, Asikta Shiriya and Pumanjada Baladika. Okay, so these are the 4 pada you can see in Vajikarana. So total number of Vajikarana yogas are 50 in number. So Samyoga Sharamuliya in there 15 Vajikarana yogas are there, and in Masha Parana Brabhridiya 15, Asikta Kshiriya Vajikarana that is 8 yogas are there, and Pumanjada Baladika 12. So total 50 Vajikarana yogas are mentioned in the second chapter of Vajikarana. Okay, so these are the Rasayana yogas and Vajikarana yoga. Next, some additional jwara we can see. Okay, Mandhara jwara that is mentioned by Yoga Ratnagara. Vada Balasaga jwara it is mentioned by Ashtanga Sangraha. Pralebaga jwara is mentioned by Sushruta Samhita. Then Vishaja or Aushada Gandhaja jwara is there, that is mentioned by Madhavagara. Then Abaprajada Janya Stri jwara, like during the postpartum period. Okay. So that time jwara will be getting, so that is mentioned by Sushruta. Eshana jwara that is mentioned by Kashyapa. So these are the some additional jwara we can see. So that is mentioned by each Acharya they have mentioned. Then Agantuja jwara. Okay, Agantuja jwara that is also different types are there. So in that Abhighadaja jwara, due to trauma we can get jwara. So there which are the doshas are vitiated? Vada and Rekta dosha. Abhishangaja. So here Vada Pitta is getting vitiated. Abhijara and Abhishaba jwara that is formed by Sannipadika. So these are the dosha predominancy you can see in the each Agantuja jwara. Next one is according to Vakphata 8 type of Bhagandara is there, and their dosha vitiation. That is also we have already seen. Shadaponaga that is vitiated due to Vadika, Ushtragriva Paitika, Parishravi Kapaja, Shambhugavata Sannipadika, Unmargi Aganduja, Parikshevi Vada Pitta, Riju Vada Kapha, Arsho Bhagandara Pitta Kapha. So these are the 8 types of Bhagandara and its dosha vitiation. Then Bhagandara Chigilsa according to Sushruta for the Shadaponaga, Ardha Langalaga, Langalaga, Gotirthaga, Sarvado Bhadraga. In this way you have to do the Bhedana Karma. Okay, different type of incisions are there. No? So in these 4 way you can do the Bhedana, and then afterwards you can do Agni Karma. Okay, then in Ushtragriva, Kshara Karma Nirdishta. Ushtragriva is a Pitta Pradhana condition, but then also Kshara Karma is indicated in Ushtragriva, but Agni Karma is contraindicated. Okay, Ushtragriva, it is a Pitta Pradhana Vyadi, but Agni Karma is contraindicated, but Kshara Karma is indicated. Okay, but you can put very less amount of Kshara in Ushtragriva. So Kshara Karma is indicated, Agni Karma is contraindicated, and you can put Tilakalka Grida Levana. Tilakalka mixed with Grida, you can apply in the Ushtragriva. Then Parishravi. It is a Kapha Pradhana condition. So here Kharjura Patra, Ardha Chandragara, Avang Mukha, Suji Mukha. In these ways you can do the Bhedana Karma, and then you can do Kshara and Agni Karma. Both you can do in Parishravi Bhagandara. So this is a treatment for the these types of Bhagandara. Next one is dosha predominance and this sadhya sadhya, 5 types of Shvasa Roga. Okay, Mahashvasa, it is vitiated due to Vayu dosha and it is asadhya. Urdhva Shvasa, that is also vitiated due to Vayu dosha, that is also asadhya. Chinna Shvasa, here Vayu and Kapha dosha both are vitiating, this is also asadhya. Tamaga Shvasa, it is due to the Kapha dosha and it is yapya. Okay, Tamaga Shvasa is yapya, manageable only. Asthma is a manageable condition, we can't cure completely, right? In between the time they used to get the asthma attack, and then taking the medicine it will come down. Again there will be climatic condition changing, again they will used to get the wheezing. Okay, so Tamaga Shvasa is yapya. So in wheezing always they will be having mucus is getting lodged in the trachea, like in the bronchi. All this area mucus is getting lodging, and because of that what happened, air circulation is not getting, so that's why they are getting that wheezing sound, breathing difficulty. So in that way you can think that Tamaga Shvasa is Kapha dosha predominancy. Okay, if you apply some heat in the chest area, then what happened, the mucus will become dissolving and the wheezing sound reduces, and breathing also they will be getting properly. So Kapha dosha will get reduces while applying the Ushnatva. Okay, so in that way you can correlate that Tamaga Shvasa is basically Kapha dosha and it is yapya. Shudra Shvasa, it is a Vayu dosha predominant and it is sadhya. Okay, so this is the only one Shvasa Roga which is sadhya, that is Shudra Shvasa. Okay, Tamaga Shvasa is Kapha dosha predominant, it is yapya. Rest of the 3 doshas are asadhya. Chinna Shvasa, okay, so that is Vayu and Kapha dosha. Okay, Chinna Shvasa, repeated breathing difficulty will be there. So Vayu and Kapha both are responsible for getting Chinna Shvasa. Then Jwara Adhisara, Rekta Adhisara, like that 2 conditions are there, that is mentioned by Madhavanadana. Okay, Jwara Adhisara, Rekta Adhisara, like that conditions are there mentioned by Madhavanadana. Next one is Visarpa. Okay, in Visarpa, which are the dosha vitiation? Agneya Visarpa, that is vitiated by Vada Pitta dosha. Grandhi Visarpa is vitiated by Kapha Vada dosha. Kardamaga Visarpa is vitiated by Pitta Kapha dosha. Okay, so these are the dosha predominance of the Visarpa. This is also important. Next one is related with the Agada. Kita Sankhya. So total number of Kita, that is 67. The 67 is from that Vadika Kida is 18, Paitika Kida is 24, Kafaja Kida is 13 and Sannipadaja is 12. Then Mushaga Visha, that is total 18 in number. Vrishchiga Sankhya, that is total 30. So this 30 is Manda Madhya Tikshna. So Manda Vrishchiga is 12, Madhya Vrishchiga is 3 and Tikshna Vrishchiga is 15. 12 plus 3, 15. That in that way, Manda Madhya Tikshna, 12, 3, 15. This is the total Vrishchiga Sankhya. Okay, then Luta Sankhya, according to Sushruta, it is 16. So in that 8 are Asadhya and the 8 are Kritra Sadhya. According to Vagphata, 28 total number of Luta is there. Then Luda mein Visha Adhishtana. Okay, when the Luda bites, which are the locations where the Visha will be getting? 7 location. And the Chigilsa Upakrama, 10 Chigilsas are there. In that Basti has not mentioned. Then Luda Visha mein Mrityu. If it is a Tikshna Visha is getting in your body, within 7 days patient will die. If it is a Madhya Visha, within 10 days. If it is Hina Visha, 12 days the patient will die. So these are the main things related with the Luda Visha. Okay, the rest of the things we'll discuss on the next video.